Hi, my name's Heather Wardle and I'm from the National Centre for Social Research in the UK. We are primarily known for conducting the British Gambling Prevalence Survey, but also we're really expanding our repertoire of research that we're conducting and trying to focus on how we can work in partnership with other organisations to help foster a joint and joined up responsible gambling strategy. So you've just heard from Malcolm some preliminary results of the work that we've been doing with BetVan. In this very brief overview, I'm going to draw on some of the most recent findings from the British Gambling Prevalence Survey to talk about how we conceptualise problem gambling and why that's important. What the situation looks like in Great Britain in terms of gambling behaviour and what that tells us about public health approaches. I'm then going to draw very briefly on some of the comments that have been abundant in certainly the academic debate over the past few years about the relationship between gambling exposure and gambling behaviour and what evidence from Britain tells us about that particular debate. And then I'm going to get on my soapbox, I'm afraid, although I feel like I may be preaching to the converted here, to talk more about the need for a joined-up approach between regulators, researchers, treatment providers and industry in order to fully understand gambling behaviour. We know gambling behaviour is a complex phenomenon, and we know that gambling opportunities have increased, particularly with the advent of the internet. I think it's really important to remember that gambling is not a new phenomenon. The ancient Greeks, for example, were betting on the rolling of bones. We know that probability theory was founded on the need to better understand games of chance. Though gambling itself is not indigenous to all cultures, it's not necessarily a fact of life. We know from anthropologists that there are areas in the world where gambling did not exist until colonisation. All of this means that understanding gambling behaviour is incredibly complicated and really does need to be considered within specific social and cultural contexts. What we also know, however, is that there is an increasing recognition that people who gamble may experience some problems. Not everyone, but some people do. Again, this is not a new phenomenon. Back in the 14th century, Richard III, for example, outlawed his archers from playing dice games because he was concerned that their preoccupation with playing these dice games was leading them to neglect their duties. So here the principle of an overindulgence in a particular type of game causing someone to have harm or damage to their professional pursuits is quite clear, and that is a theme that we still talk about today when we talk about problem gambling. Now, in the 21st century, people accept the fact that some people experience gambling problems, and it's increasingly accepted by most stakeholders. For example, we've heard from Malcolm this morning talking about Betfair's approach to minimising the risk of harm. Despite this consensus, however, let me just see if this works. There we are. There are still an abundant ways and many different ways of thinking about problem gambling and defining it. What we see on this slide are some examples of how people have approached the issue of problem gambling and conceptualised it. The first there is problem gambling is gambling to a degree that compromises, disrupts or damages personal, family or recreational pursuits. Here the focus is on the harm or the consequences from problem gambling. Others, and this is particularly from the American Psychological Association, describe problem gambling or pathological gambling as persistent, recurrent, maladaptive and a mental disorder. This has also been modified by some people saying it's a mental disorder characterised by continuous or periodic loss of control. And the use of the word periodic there is particularly important because it moves away from that idea of problem gambling necessarily always being chronic. And finally, there are other viewpoints where gambling behaviour is a continuum, where problem gambling is essentially a behaviour that presents in varying degrees and forms. That is, gambling involvement rests on a continuum from occasional non-problematic use through to extreme over-involvement. So, as you can see, we are far from having a unified understanding or definition of problem gambling. And the question is, does this matter? Yes, I think it does matter, because the way we think about problem gambling informs the kind of regulation we may recommend, the types of policies we use, the kind of research we conduct, the kind of treatments we then recommend. So, for example, if you believe that problem gambling is chronic, recurrent, maladaptive, that may lead you to think that a more paternalistic approach to regulation may be appropriate. For example, maybe a more prohibitive approach. However, if you believe that gambling behaviour exists on a continuum, whereby at one end of the spectrum you have people who enjoy gambling and experience no problems, and at the other end of the spectrum you have people who get themselves into difficulties with their behaviour, that may lead to a more public health based approach where we think about what initiatives we can introduce to prevent harm, to think about vulnerable or at-risk groups. The continuum approach is gaining increasing acceptance, and certainly in Great Britain this is the way that we're starting to move towards when we're thinking about gambling behaviour. The continuum approach is also really useful because it gives rise to the idea that there is a vulnerable group, a group of people who may be at risk of experiencing harm. And that's very important when taking a public health-based approach to gambling. So the question is, how does this spectrum look in Great Britain? And I'm afraid the colours haven't come out as I'd have liked. The most recent evidence from the British Gambling Prevalence Survey shows us that around 13 million adults in Britain did not gamble at all in the past 12 months. They didn't buy a lottery ticket, they didn't go to a bookmaker's, a casino, they didn't even have a bet in private with their friends. They were complete abstainers. We then have a further majority of 31.8 million adults who did do some form of gambling in the past 12 months, and when asked about a range of consequences or experiences with their gambling, reported that they had experienced no harm whatsoever whilst gambling in the past year. So that's the majority. What we then have coming into these darker colours are those groups who gambled in the past year, many of whom gamble very regularly, gamble on very many activities. But when asked about questions about their experiences of gambling, they gave answers that classified them either as low risk, moderate risk, or problem gamblers. Now, yes, when you look at the population profile, they are a minority, but we're still talking about 3.9 million adults being in that at-risk group or being a probable pathological or problem gambler. In Britain, we estimate there's around 400,000 problem gamblers based on this survey data. So really, it's this at-risk group that needs to be the focus of responsible gambling strategies. It's really crucial to try to prevent those at risk from experiencing further harm. Also to prevent those not at risk from developing problems and experiencing harm. Though, as I've said, it should be pointed out the vast majority of people either don't gamble or gamble with no problems. However, the greatest gains are to be made by focusing responsible gambling strategies on that at-risk and vulnerable group. Because at a population level, if we can make small improvements with that group, it actually leads to vastly greater gains just because of their sheerly vast small numbers. So prevention really needs to be a key strategy. Mainly, and I'm sure everybody knows this, but the cost of preventing harm far outweighs the cost of treating problems. In the UK, we take this approach for many of our health-based issues: smoking, drugs, alcohol, obesity. We have a public health-based approach where we talk about prevention initiatives. Unfortunately, gambling policy lags behind that, but that's the way the dialogue is starting to develop, which is very encouraging.